Assalamu alaikum everyone. My name is Sayyida Heba Bukhari and today our conversation would be on the surface marking of bone. As we all know that there is a lot of terminology which is used to explain the bone anatomy, so we will be discussing about them one by one, so it would be easy for you guys to understand anatomy more easily and more cordially. Okay, let's begin. First of all, we will be discussing about the linear elevation. So let's talk about a line. What is a line in the anatomical terminology? So a line is a projection in an area of bone which is projecting above the surface of the bone. So if we take a look over the posterior view of the skull, you guys can see that this is the occipital bone located on the backside of a skull, and there is a superior nuchal line present over it. So it is a line which is projecting above the surface of the occipital bone. Superior means something above, nuchal means the posterior or the back view, and that the line is a straight thing which is projecting above the surface of the occipital bone. Now the next term is a ridge. So the ridge is a rough elevation that is stretched along the surface, and it is something that is non-articular in nature. If you take a look over the distal end of the humerus, you guys can see something labeled as a medial supracondylar ridge and the lateral supracondylar ridge. So ridge is something which is a rough area which is projecting from the surface of the bone, and the medial and the lateral word indicate the side. Medial means toward the center of the body and lateral means away from the central of body. The supracondylar, supra means above, and condylar is something which I will discuss further in the video. Now the next term would be the crest. If we are talking about the crest, a crest is something which is present at the edge of a bone. So let's take a look over the hip joint. As you guys can see, this is the hip bone which include the ilium, ischium and the pubis. So the ilium itself is covered by the iliac crest. The iliac crest is present, highlighted in the red color is the iliac crest. It is present at the edge of the ilium. Now let's talk about the rounded elevation of bone. First of all, what is a tubercle? A tubercle is a small, rounded, pointed prominence of a bone. If we take a look over the hip bone again on the pubis, you guys can find out the pubic tubercle. So the pubic tubercle is a pointed prominence, rounded in shape, present at the edge of the pubic bone. Now the next term used for the rounded elevation is a protuberance. So a protuberance is a swelling, bulging or protruding part of the bone. As you guys can see again on the posterior aspect of the skull, on the occipital bone below the superior nuchal line, there is an external occipital protuberance, which is again a swelling, a bulging or a protruding part of the occipital bone. Now let's talk about what is a tuberosity. So a tuberosity is a broad, rough, irregular depression which is located on the bone for the insertion of muscles mainly, or any tissue attachment. So if we take a look over again on the humerus bone, you can find out the delta tuberosity. So the delta tuberosity is a tuberosity, a depression, a rough, irregular area for the insertion of the deltoid muscle which is located on the proximal end of the humerus. Another term which is commonly used for the rounded elevation is a malleolus. So a malleolus is a bony bump on the inside of ankle. As you guys can see, this is an ankle joint diagram, and you can see the lateral malleolus and the medial malleolus labeled over here. So the lateral malleolus is something which is present away from the midline of body. This is laterally, and medially means something which is located toward the midline of the body. So the medial and the lateral malleolus of the tibia and the fibula respectively are considered as the bony bump on the ankle joint. Now let's talk about the last term used for the rounded elevation is a trochanter. The trochanter are present on the femur bone. As you guys can see, this is a proximal end of the femur bone which include the femoral head, the femoral neck, the greater trochanter and the lesser trochanter. So the greater trochanter and the lesser trochanter are located near the hip joint on the femur bone, which have the importance because of the insertion and origin of the muscles. Now let's talk about this sharp elevation which include the spine or the spinous process. So the spine or the spinous process are just something which is a bony prominence which is cylindrical in shape. As you guys can see, this is a diagram of the lumbar vertebrae whose body is kidney shape, and you guys can see there is a spinous process labeled over here. So this is a spinous process which is a bony prominence which is cylindrical in shape, and these spinous processes are located on the posterior aspect of the vertebrae, all the vertebrae from the cervical to the coccygeal. Another term used for the sharp elevation is a styloid process. So the styloid process exists in the temporal bone. It is also a cylindrical or the cylinder shape which is not more than 2 to 3 centimeter long. It is located on the temporal bone on the lateral aspect of the skull, labeled as red color in the diagram. Now let's talk about the expanded end of the bone. Let's take a look over the humerus bone again. As you guys can see, the head is a prominent rounded structure present on the proximal end of the humerus bone. The head has an importance because it helps in the formation of the joint, like the head of the humerus help in the formation of the shoulder joint, the head of the femur help in the formation of the hip joint. Now moving toward the lower end of the humerus bone, as the lower end is expanded and is termed as a condyle. The condyle means something which is prominence at the end of the bone which often take part in the joint. As you guys know that the lower end of the humerus bone take part in the elbow joint, and the lower end of the femur take part in the formation of knee joint. So as you guys can see that the condyle is covered with the epicondyle. The epicondyle is a prominence which help in the muscle attachment. Now the last part of the video, let's talk about the depression present on the bone. So notch. The notch is a face on which the other bone can slide in or out. Due to notch, the gliding movement are possible. For example, if we take a look over the ulna bone, so there is a trochlear notch and the radial notch of ulna, which make the sliding movement possible on the elbow joint. Another kind of depression present on the bones is called as a groove or the sulcus. So here again on the humerus bone you can see the intertubercular sulcus, which is also called as a bicipital groove, is a depression which provide space to avoid the compression of the adjacent muscle. Now the last type of the depression found on the bone is a fossa. So let's take a look over the humerus bone again. At the lower end you can see the coronoid fossa. So the fossa is a shallow depression in the bone surface. Okay guys, so that's all for today. I hope you guys like the video. If you do so, then make sure to like and subscribe to the channel The Mat Corner. See you in the next video. Take care. Bye bye. Allah Hafiz.